My name is Ana Melo, and today I'm going to talk about mood disorders, major depression. Mood disorders include disorders that have a disturbance in mood as a predominant feature. These are characterized by either depression, elation, or some combination of these two extremes. As you can see in the slide, major mood disorders are subclassified as bipolar disorder, major depression, cyclothymia, and dysthymia. Major depression. Psychiatrists treat more cases of depression than any other emotional disturbance. 8 to 10% of Americans suffer from a major depression at some time in their life. Many more persons have symptoms of depression but don't seek treatment. It's important to understand that culture can influence the experience and communication of symptoms of depression. Depression occurs more often in women and affects many people in the higher socioeconomic bracket. Women are at significantly greater risk than men to develop major depressive episode at some point during their life, with a greater difference found in studies conducted in the United States and Europe. Studies indicate that depressive episodes occur twice as frequently in women as in men. It occurs more often when individuals reach their 40s and 50s, but may occur during any period of life. In children and adolescents, the mood may be irritable rather than sad. However, the core symptoms of a major depressive episode are the same for children and adolescents, although there are data that suggest that the prominence of characteristic symptoms may change with age. Certain symptoms, such as somatic complaints, irritability, and social withdrawal, are particularly common in children, whereas psychomotor retardation, hypersomnia, and delusion are less common in puberty than in adolescence and adulthood. When depression can be at least partially traced to difficult life events such as the death of a loved one, the externally triggered emotional response is said to be reactive and exogenous. Sometimes, however, feelings of depression have no apparent external causes. Such endogenous feelings can lead to chronic depression, sometimes lasting a lifetime. How does major depression feel?
It was very dark. I was sad a lot. I was angry a lot.
I would actually think that other people could see it in me. So I wouldn't want to be out in the world.
That sense of hopelessness can be just overwhelming.
It feels like I'm waking up in the morning and there's this huge boulder in my bedroom, and my job is to push that boulder up a hill all day long. That's what it feels like. And at night, that boulder rolls back down, rests at my bed, and it's waiting there for me in the morning.
And I remember thinking, why do I feel this way? Why can't I be happier?
Diagnostic criteria. The essential feature of a major depressive episode is a period of at least 2 weeks during which there is either depressed mood or the loss of interest or pleasure in nearly all activities. Depressed mood most of the day. Diminished interest of pleasure in all or most activities. Significant unintentional weight loss or gain. Insomnia or sleeping too much. Agitation or psychomotor retardation noticed by others. Fatigue or loss of energy. Feeling of worthlessness or excessive guilt. Diminished ability to think or concentrate or indecisiveness. recurring thoughts of death. What is the treatment?
Individuals that have a major depressive disorder have a significant medical illness. It's essential that an individual who is depressed seek medical care. And the reasons for this are multiple. The first is for you to feel better. And second, it may affect the structure of your brain. Third, the longer you stay depressed without treatment, the harder it is to get back to baseline.
Baseline, or remission, is the goal in treating depression. It means that patients have no symptoms at all. But many people who suffer from depression don't even seek treatment, sometimes because their depressive state leaves them unmotivated or unable to see their condition clearly, or often because of the social stigma of the disease.
The thing that I felt often was that it was a weakness in me, that I was not strong enough, that I needed to just bite the bullet and go forward.
There are several ways to treat depression. Most common is psychotherapy, also known as talk therapy.
I believe that if you're struggling with patterns that just keep showing up in your life, or moods that you can't seem to ever shake, talk to someone, go see a therapist.
Depending on the person, very often changing the way that you think can change the chemistry of your brain.
It's important to realize that psychotherapy, when successful to treat depression, is also impacting neural circuits and helping restore the proper functioning of those circuits.
Many people with depression are in need of medication to alter their brain chemistry, but again, there's a stigma.
Having people be resistant to medication is often a symptom of depression. They're just not thinking clearly. You know, it's like if somebody had diabetes, they would not have the social stigma about taking insulin.
Antidepressants work by restoring the proper balance of brain chemicals, also called neurotransmitters, associated with feelings of well-being. The side effects vary, and the medications can affect different people differently, and most antidepressants take several weeks to take effect.
What my medication helped me do was introduce shades of gray into things. It wasn't horrible. It was not great. And I have to say that that was like the turning point of my life.
No matter the treatment or combination of treatments, social support and healthy lifestyle factors have also shown to improve results in depressed patients.
Indeed, exercise, nutrition, and focus on wellness have a significant role in treatment of major depressive disease.
Brain's about 5% of our body, but it takes up about 20% of the energy. So it's a highly energetic organism, even when we're asleep. So getting proper blood flow and nutrition to the brain is important. So physical exercise is important.
Not only is the treatment of depression highly successful in terms of making people feel better, but recent imaging studies suggest that damaged brain tissue and neurons can return to normal with successful treatment.
But I think it's very, very important for people suffering from depression to realize that they are very, very likely to be treated successfully.
As Christians, what can we do against depression? As Christians, we must understand that not everything is spiritual. Also, we have to learn to identify when the condition is chronic and refer the person to a qualified specialist. In addition, it's important to give support and pray for them.